Well, hello, everyone. For those of you I haven't met yet, my name is Chris Ship, and it's my privilege to serve as the Dean of the Faculty of Applied Science and Engineering here at the University of Toronto. While we meet today on a virtual platform, I'd like to begin by acknowledging the Indigenous peoples of all the lands which we are on today. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. So please join me in a moment of reflection to acknowledge the land on which you are operating. Today, I'm calling from Toronto, and I would like to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. And today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. So I always really look forward to these Disruptors and Dilemmas panel discussions, which have been going on for well over a decade now. It's not only a great chance for us to learn about the relevant issues at the intersection of technology and society, but really is a terrific chance to connect with our colleagues from other disciplines, spark new collaborations, which enable us to think differently about big challenges and really just get great conversations going. And for that, I'd love to thank our partner faculties, the Faculty of Arts and Science, the Rotman School of Management, and the Temery School of Medicine for their collaboration on this event. It really is great to have three different groups be part of this with engineering. We've all come together from across U of T, Toronto, and in fact beyond to discuss the topic of healthy aging in place. It really is a reality here in Canada. Our population is becoming older on average. And over the next 2 decades, this is kind of scary. The number of people over 65 is expected to increase by 2/3. The number over 75 is expected to double. I will admit that I will be part of that population, which is kind of scary to think about, frankly. And ensuring that these people can maintain the quality of life they have come to expect, as well as preventing our healthcare system from becoming overburdened. It really is a huge multidisciplinary collaboration, something which we've just been talking about. And so as engineers, we can leverage tools such as wearable sensors, robotics, and even AI, artificial intelligence, to design our assistive technologies. But it's really important to also understand the social, ethical, and kind of cultural factors which determine really how useful these technologies will ultimately be. Technologies have to work for everyone. A really nice example of this is AgeWell, which is led by our very own Professor Alex Mihalidis. AgeWell is a pan-national network of centers of excellence launched by the federal government a few years ago, actually, one of the most successful network of centers of excellence in Canada. And it's also a U of T institutional strategic initiative that brings together everyone to develop technologies and services for healthy aging, while also fulfilling a mandate of training the next generation of experts in the field. Wonderful examples of this, some of which you're going to hear today from our distinguished panel. This actually does loop back to one of our pillars of our Defy Gravity campaign, which includes promoting healthy societies and designing intelligent machines for good. Defy Gravity is really helping address some of the most critical issues of our time, not only through financial support, but also encouraging alumni to contribute their time and talent to the university. You've already brought us so much closer to that goal by simply being here today. So again, thank you for your participation. This is going to be a wonderful discussion. So I'd like to welcome our moderator, Claire Kennedy. Claire is an alumna of U of T Engineering, former chair of U of T Governing Council, and the past president of the Engineering Alumni Association. Currently is co-chair for the Defy Gravity fundraising campaign. Claire is helping to lead a coalition of volunteers devoted to inspiring the highest level of support for advancing U of T excellence and aspirations. Many of you know Claire played a key role in launching this lecture series, back then called Biz School, now called Disruptors and Dilemmas. A wonderful, actually, I love the way that this has flowed out. This is really so key. So again, thank you, Claire, for all your hard work and determination and keeping this whole series going. It really is being remarkable. And also thank our sponsors, TD and Manulife, for making this event possible. So with that, I'm going to turn it over to Claire to take over the virtual podium. So Claire.
Thank you, Chris. I'm absolutely delighted to be back moderating Disruptors and Dilemmas again today. I learned so much from these sessions from our panelists, but also from you, our audience, who send in absolutely great questions, and today is no exception. This topic, empowered aging in place, has clearly resonated. And that's not surprising, I think, since we are all somewhere on that journey of what I'll call seniority. I'm so pleased that we have three very qualified panelists to speak to this topic today. Professor Mark Chingle is a professor of industrial engineering, the director of the Interactive Media Lab, and founder of Centivisor, a company with a mission to unleash the potential of technology to promote healthy and active living for the elderly. Welcome, Mark. Professor Babak Tati is an associate professor and senior scientist affiliated with the KITE Research and Rehabilitation Institutes and the Department of Computer Science. He serves as the lead of the KITE aging team, and a major focus of Babak's work is to develop devices that work reliably in the home and in long-term care settings. Welcome, Babak. Rotman alumna Jen Flexman rounds out the panel. Jen is the COO and co-founder of Minetta Health, which provides tailored brain exercises, strategies, education, and family support, aiming to improve cognitive function and daily life activities in individuals with mild cognitive impairment and dementia. So let's jump right in. I've got an opening question that maybe is going to be a bit of a level setting for us, and I don't want to dive into the conversation. We're going to use some of the questions that we've got from the audience. We've had so many that unfortunately we won't be able to get to all of them, but we will be sending out a survey at the end, audience members, with a link to some other events and resources at U of T that you'll find interesting if you're interested in this topic. So here we go. What is the biggest opportunity and what is the biggest challenge for aging in place? I'm going to start with Jen on this, and then I want to go to Babak and then to Mark. So Jen, over to you.
Thanks very much, Claire, and thank you for the opportunity to participate in such an important discussion about aging, a discussion that we need to surface more in society today. It's a topic very close to my heart. As the co-founder of a brain health startup in the aging space, it's something that I think about every day. We're really focused on helping older adults to stay as independent as possible for as long as possible. People want to stay in their homes, and cognitive function is a big part of helping people be independent and also engage socially with their friends and family. We bring together a platform that combines licensed therapists with an AI voice platform that is delivered entirely over the telephone. We take a lot of thought into how to design for older adults and how to deliver the best possible experience. And our goal is really to bring hope and dignity to the process of aging so that everyone has the opportunity to make the choices that they want about how they want to be an elder person in society. So what are the biggest challenges that I see in the aging space? I mean, I think the biggest challenge I see is the stigma and some of the preconceptions that we have around aging today. So we often think of the aging process as purely a time of loss, of decline, but actually there's a lot of evidence that our elder years are some of the best years of our lives if we're lucky enough to get there. We spend decades of our lives as elders in society, and I think it's time that we challenge some of these preconceptions that exist in society today. And nearly 20% of Canadians today are over the age of 65. And that number has tripled in the last 40 years. So I think the opportunity is really, how do we build on this momentum and this growing cohort of people who are saying, I want to do things differently. I want to have purpose and joy in my life till the end. And how do we really incorporate the needs and beliefs of older adults into the way we design society, our built environment, the products and services that we offer to really reflect that changing demand and to do things differently. I think we're just on the cusp of really a revolution in the aging space, and I think we're going to hear that from everybody here today.
That's great. Thank you, Jen. You touched on some important themes that we're definitely going to come back to. Let me go to Babak with this question then. Biggest opportunity and biggest challenge for aging in place.
Hi, everyone, and thank you also again for inviting me. It's my pleasure to be here. I'm going to echo what Jen mentioned, and we keep talking about aging population and the number of older adults that are going to increase over the years, but accompanying that is the reduction in the proportional number of younger adults who traditionally take care of older people. So as the time goes on, the burden of care, the cost of care, and the load on the younger people who will be taking care of some of the health issues associated with age will increase. So some of the opportunities is to develop technologies that support caregivers, either PSWs or informal family caregivers, to enable them to more effectively provide care for older people. That can be technologies as simple as non-AI technologies, but more what I focus on is AI technologies to help them be more efficient with their time and the way they provide care. And another challenge that I want to touch on is also what Jen mentioned is in addition to health and physical well-being challenges, we also have very important issues related to social isolation and loneliness. So, for example, older adults living in home may lose their driving license or their ability to walk independently for longer distances, and that limits their chances of going to their usual socialization places. The opportunity that comes with that is taking advantage of some of the available technologies to help with that and provide opportunities for socialization online or virtually.
Great, thanks, Babak. Let me come to you, Mark, now.
Yeah, so I think the biggest challenge is opportunity is prevention. Sorry, opportunity is prevention. That, we used to think that aging was a disease, and now we realize it's like running a race as slowly as possible and being the last runner to finish with a quick sprint to the end. And there are many things we can do to prevent physical and cognitive decline. The problem is that there's a lot of inertia in the system because we have this disease model of aging that is still there. And where we have a whole lot of ambulances at the bottom of the cliff where their engines are running. And what we should be doing is, building a fence at the top of the cliff, but people just don't want to spend the resources because like, no, we got to pay for these ambulances. So I think, that if we can somehow move the resources to prevention, it would be a huge opportunity for us. And maybe they should rename the Ministry of Long-Term Care the Ministry of Healthy Aging. Thanks.
That's a great suggestion and a good jumping off point. What I found was so interesting in the way each of you spoke to these questions is that you've touched on, I think, really the need for a sort of a holistic approach to aging. So there's dealing with changes in physical capacity, but also that the social piece and the mental piece and how they're very much interconnected as determinants of overall health. So let's come to another question. Jen, I'm going to go to you, and then I'm going to come back to Mark about putting the we'll call it the senior kind of at the center of this question. So how can we use user-centered design to enhance the quality of life and safety for aging populations? Jen, I'll come to you, and as I said, then Mark.
Yeah, I mean, great question. And, I think it's how we approach many other things in society is simply bringing older adults into the conversation. So, nothing for me without me is a good mantra. At our company, we bring in the voice of the people we work with every day to our product design decisions, how we interact and build our interfaces. We deliver everything that we do over the telephone, and we made that decision very deliberately because we realized that it reduces the friction associated with a lot of conventional smartphone technology that can be very difficult for older adults to use. And it doesn't mean that older adults don't use smartphones. We all know that's not true. It's really just that people use technology differently, and we need to recognize those preferences, those beliefs, and integrate that into how we design products and services for older adults. Often, we're taking products that were designed for younger people, and we're giving them to older adults and expecting them to use them the same way. And we know that's not true. So I think there's so much opportunity to really focus on building things that have meaning for this specific population.
Great. I think it would be hard to argue with any of that. And you know, the reality is that seniors, when we see the numbers that we're talking about, are you know, important consumers. So having businesses respond to them, and again, putting the user, I'll call it consumer at the center of the design process, you know, makes a lot of sense for many reasons, including perhaps even more importantly, that question of autonomy and dignity of the individual.
Yeah.
Mark, let me come to you.
Yeah, so Jen kind of answered the question in terms of existing products and, you know, services that you're going to make accessible for older people, but there's also innovative products that one has to consider. And there, I think it's not enough to look at user-centeredness from the point of view of requirements and participation of users in the design discussion, but you also have to look at, you know, users in an iterative design process in the actual setting of use. And that's extremely informative, but it takes a long amount of time. So this stuff requires patience. But the more, you know, user experience you have in like living labs in places like retirement communities, assisted living, and so on, I think that we can really sharpen up our products and make them more effective. And the other thing is that there's a lot of innovation and ideas out there, and you know, somehow we need to find a way to give people opportunities to evaluate their products, you know, and screen the ones which are going to likely to be most effective, and find the right settings and uses for them, because you can have a good product that just doesn't fit the kind of target user you're going after. So it's kind of a complex problem figuring out which product you want to have and who the right user is.
Said like a professor and an entrepreneur, and I'm going to come back to that at a later question, Mark, and ask you about that journey. But you talked about innovation, and that is going to lead me to a question on AI. We've had a number of these. It won't surprise anyone. And Babak, you touched on AI, but not only AI in your opening answer. So I want to come back to you and ask, how is AI impacting the solutions that we are seeing for aging in place? And are there challenges specifically around applications of AI in this context? And then maybe I'll come back to Jen for your perspectives on this question.
Yeah, absolutely. There's tremendous opportunities, but with that also comes some very important challenges. We need to be aware of the challenges while developing these technologies. The goal and hope for the technology is to have systems and technologies that empower older adults to take an active role in the management of their chronic conditions and in their health and well-being, and physical and social. So, for example, some of the automated assessment tools that are being developed at U of T and UHN are on that front. And also, we can have AI solutions to help caregivers, PSWs, or nursing staff, or family caregivers who are often busy taking care of a million things at the same time, be effective and more efficient with their time and care. An example of that is some of the things that we're developing for long-term care that can be very directly also be applicable in the home. So, for example, things like assessing pain, which is very common in old age, and especially in older adults with dementia, but very under-detected and very under-diagnosed and under-treated. It is possible for people, care staff, to go check and visually assess pain, but because hospitals, long-term care homes, and also caregivers at home are very busy with lots of other things providing care, and it's not always possible to do it in a timely manner. So AI solutions we are developing monitor pain, signs of pain, and notify staff or caregivers that this person at this time might need your attention. So instead of having to go check on them very regularly, you can rely on the technology to be able to provide your care more efficiently. But the challenge that comes with that is that technology needs to be very reliable, and also there are issues related to bias. If we develop and deploy this technology and everybody relies on it, once it is being used, nobody's going to remember that there was a fine print in it that said, this technology may not work so well for men over 75 or for people who have dark skin. So we need to make sure, and then it becomes standard of care, and it may provide some inequities in terms of how care and pain management is provided to people who need it. So there are very important opportunities that we're working on to try to use AI to provide care and make the provision of care more effective and efficient, but there are also some important challenges that come with that. Bias is one of them. Another related challenge is regulation and having regulations that support technology development and technology deployment. One of the challenges for now is the model that we have for health technology is a technology or a intervention that is static. So you have a technology or solution, whatever it is, you run some studies, you get Health Canada approval or FDA approval, and that's it. That's your model, your solution, intervention, and it's in the market. But one of the advantages of AI and artificial intelligence and continual learning is that you can have a system that adapts over time. And it's very difficult to take advantage of that opportunity with a model that gives regulatory approval to a static system at a given time. Because what happens down the road, two months down the road, or 3 years down the road, when my AI model has learned more and now behaves differently? Do I need to go get a new approval, or do I need to continually get new approval? So there's interesting challenges that come with these new technologies that are being developed. And we need to be very smart about how we update and bring our regulatory process to become up to date.
Yeah, you touched on a good point there, Babak, and I think it shows how multidisciplinary these questions are. And you know, I will just say, as a plug for U of T is a great locus for this kind of work, because we have the resources, you know, whether it's in engineering, medicine, but also in philosophy and ethics and in public affairs. And you know, another challenge, I think, in addition to those that you spoke very eloquently about, is just this question of privacy also. So there's definitely advantages for essentially real-time monitoring of, you know, perhaps it's pain or other indicia of discomfort that we would want monitored. But then I think there's a balance to be struck also around the surveillance question. So no doubt fodder for another Disruptors and Dilemmas or interesting panel. But let me come to you, Jen, on this question around how is AI impacting solutions? And again, are there particular challenges that you want to highlight or call out?
Yeah, well, you know, I think AI has a lot of potential to really address some of the fundamental challenges that we face in delivering products and services at scale to the aging population. So it doesn't take much to see that the healthcare system in Canada and in other jurisdictions is just struggling with care provider shortages, with cost. I mean, there's no room to come in and say, hey, we've got a great solution, you just have to pay more money. I mean, I think we need to be truly innovative in how we think about using AI to challenge the notion that we just need to spend more money to deliver better services. At Moneta, we bring AI into our platform in order to offer more than half of our therapy through an automated voice system. The reason we do that is because we don't want to just layer on more people to this model. We want to be able to use AI to deliver something that is accessible at any time of day. And then in turn, we don't have to rely on having care providers that just simply aren't there. And so I think there's huge potential in being able to use technology appropriately to be able to not only improve the user experience, but also to address some of these challenges that we're experiencing today in society around cost and just scalability in the health system. But Babak highlighted some really valid concerns around how do we regulate and manage AI as it becomes more pervasive in our lives. One item in terms of older adults is the potential bias that a lot of the models that are developed may have in not incorporating enough data from older adults. If we look at a parallel in clinical trials, it wasn't until 2019 that the NIH actually required that older adults be included in clinical trials for regulatory approval. So I think we have the opportunity to not make that same mistake in the AI space. The regulations have yet to be really firmed up in AI, especially for healthcare. And so I think we can set some guardrails and make sure that older adults are represented within the models and how they're used in different applications, and that we really look for sources of bias, acknowledging that that is going to exist, but also working to reduce that as much as possible as these new technologies get rolled out to use in society.
Can I jump in with a quick?
Yeah.
So Jen mentioned something very important with, of including older adults in healthcare studies. There's a similar thing in including older adults in training data for AI models. We've seen a lot of development in generative AI with AI models that can do object recognition, tracking, generate response to questions, and so on. But a lot of those models, when you try to get something related to older people, they either fail or their performance goes down. So, for example, facial recognition, facial emotion recognition. We've done lots of experiments on this. They work very well on faces of young, healthy adults when you try them. But when you try it on a face of a 93-year-old person who may have had a stroke with facial asymmetries and they have lots of wrinkles, their performance drops significantly. So it becomes it's very tempting to say, oh, this model works really well. I'm going to try to use it in long-term care and hospital. But that doesn't always work, and we have to be cognizant of potential issues like that.
Yeah, I that makes complete sense as you say it, but it wasn't something that I would have thought about. And of course, there have been so many advances in object recognition, but you're right. It very much depends on the population on which it's trained, and perhaps it's younger people that are doing that, are leading that training effort, and so that's an example of where this bias in the population is creeping in. This is a super interesting conversation. We can continue it for a long time, but I'm conscious of time, and I do want to pivot to the question that I alluded to with Mark. Mark, you are wearing two hats as a professor and an entrepreneur, and as I said in the intro, founder of Centivizor. So, how did your work evolve? And talk to us a little bit about those two hats and that journey that you've taken in these two roles.
Well, I should say that a lot of engineering professors, I think, do look at startups, and some of them have very successful startups. So it's like a common thing, and I don't think it is competing with my professor role. I think it's supplementing and complementing it, you know. And in fact, working through the university, inside the university, has a lot of advantages. So I really benefit from my role at the university, both in research ideas and applications and prototypes, and also just access to really good students and so on. So it's a wonderful experience. I would say in terms of my current startup, I was really inspired by following a money truck, to be honest with you, in 2015 when AgeWell came along, and I was one of the co-applicants. And so it really pushed me in that direction in a good way. But I have had experience, like my last grandparent died when I was 3 years old, and I really didn't have a grandparent figure when I was growing up. And I found one. I was teaching a clarinet to an elderly gentleman in his early 80s. And what I found in that situation was I thought he was there to learn the clarinet, but he was really there for social interaction. The clarinet was just sort of, on the side. And it was a wonderful experience. And, it gave me a lot of empathy for an older person, an older man living by himself. And so I think that the business side is really good because you get a lot of practical settings. So I can do research in practical settings. So the benefits just keep increasing. When you're a professor, your research helps the business, but the business provides you with opportunities to do new kinds of research you'd never be able to do otherwise.
Right, there are a lot of there's a lot of symbiosis there, and thank you for highlighting the number of opportunities in entrepreneurship led by many of our professors. There, of course, been many successful spinouts from U of T, and there are a number of very successful incubators, including the hatchery at our very own Faculty of Applied Science and Engineering. So no shortage of activity, and as you say, I think there is a positive interdependence, both in terms of advancing research and also in learning and experiential learning opportunities for our students. I want to come back to that question of research, and I'll come to you, Babak, and I'll come to you, Mark. But first, we've touched on this. We had a number of questions from our audience that really relate to human carers. So we've been talking a lot about technology and advances in technology and how that can improve aging in place. But I think it's also important that we care for the carers. As somebody who, I will say, I suppose I've graduated from the sandwich generation because my parents have passed away, but I do have children who occupy a lot of my time and attention. So I think of myself now as being back to an open-faced sandwich, not a double-sided sandwich. But I think that human element, both in dignity for those cared for, but also in supporting human carers. So I'd like to go to all of you on this question. Maybe I'm going to put you on the spot first, Jen. Just talk to us about that balance or the right focus that we need on human care and supporting human carers in this ecosystem.
Yeah, absolutely. I mean, I think the statistics say nearly 1 in 5 of us is a caregiver to an older adult, and that doesn't even include the people who are also caring for children at home. I mean, it's the reality of most people's lives at some point in their journey. And so I think we absolutely need to address the caregivers' needs alongside the individuals who need direct support. In our program, we integrate caregivers into the program because they're often the ones that translate the benefits into daily life. So being able to have somebody who can communicate better with their loved one at home on an ongoing basis is really where you start to see impact long-term with quality of life. And so I think it's absolutely critical that we educate caregivers about how to do the job. I mean, we're often thrust into these situations with very little quote unquote training or guidance or support. And I think there's so much opportunity to be able to give people better tools to do that. And also to give them the community support. You know, I think as a society, we need to come together around the caregiver as much as we come together around the older adult. In our business, actually, caregivers are often the spouse of the individual. And so it's not that they're not older adults themselves, they're just in a different position and they may have their own needs. And so, you know, really when we start to split it all out, you know, it's all part of the same conversation. It's how do we help people age with dignity and hope, and how do we give them the right tools to do that proactively? Mark, you talked at the beginning about prevention being the biggest opportunity. Well, a lot of prevention is also just giving people knowledge and helping them understand what's coming. You know, if you know what's coming, you can prepare and you can adapt in your life, whether that's physically or mentally or socially. But if we don't tell anyone what's coming, you know, it's very hard and it becomes very reactive and scary. So I think we can do better.
Great. Lots in that, and I'm going to come back to some of that. But let me go first to Babak and then to Mark on this question.
Yeah, thank you. Yeah, echoing very, very similar thoughts. We've been talking about interdisciplinary work that is required for successful aging in place and supporting an aging population and user-centered design. And it's very important to involve end users, in this case being older adults and caregivers, in the design process of new technologies, be it AI or non-AI, from the get-go, throughout the design process, research and development, usability and efficacy studies, and eventually, hopefully down the road, commercialization and deployment. And I want to give a shout out to AgeWell that Professor Yip also mentioned, that they're a network that supports and promotes this cross-disciplinary involvement and end user design. And also, very importantly, they support, and this is something that we need to do more of and follow the AgeWell path of support, the development of technologies that go outside of university labs. So there's tons and tons of prototypes being developed in various university labs around the world that never leave the university. And we should be encouraging more of what Mark has done and translating that into commercial products to get them out into the market to make an effect and improve the quality of life of older adults.
Great. Mark.
Yeah, so I resonate with what Jen was saying. I think one of the problems is we have universal healthcare, but we don't have universal elder care, and I think it creates lots of problems, including problems with equity and diversity. So people who have money can do a lot more for their relatives than people who don't, and they can buy home care services, often high quality home care services, and I think that's really a problem in our system. That we need to deal with. So we need to find a way to give more supports to people. I think most, caregivers, they really are trying to do their best, but it's really hard and they don't get enough support. So anything we can do to improve the level of support we're giving them would be very useful. And this should include, I think, better funding, but it also should include better tools. And as Babak says, we have a lot of stuff in the lab that probably could be used. And I'll do a shout out to VHA Home Healthcare. They have an innovation lab, and they're looking at, how they can put innovations into home care settings. So a lot of people are jumping on this. It's just a question of how quickly you can solve such a huge problem.
Yeah, and I want to come back to that because we've Babak, you gave an example early on about facial recognition or recognition, maybe it's not facial, but recognition of pain and discomfort and using that as a prompt. I mean, I think it sounds like the field is very wide here. There are many opportunities, but there may be audience members who, like me, are struggling to imagine exactly what this means. So a couple of more granular examples would, I think, be really helpful of the kinds of, whether it's technologies or applications. I know, Jen, you have this service that Moneta is providing. Maybe we can just get a little bit more granular here and speak to some examples. And so, Babak, I'm going to come back and put you on.
Yeah,
to
sure.
talk
I can.
about then I'll go around the panel. So just help us visualize.
So another, so about pain or about similar technology?
Any technological advance that would have an application in the context that we're talking about, so that we,
so maybe I quickly talk about pain and a similar project related to falls. So two major issues in older adults, and especially older adults with dementia, are pain management and fall prevention. So pain management, as I mentioned, together with clinical colleagues, we've been working on ambient monitoring system that look at facial expressions and body movements, detects expressions of pain and say, this person might need your attention. And light goes on in the nursing station, then the care staff, instead of having to go check room by room, every room, they know where to focus their attention and provide more efficient care. Similar technology that we've been developing together with clinical colleagues in Toronto is fall risk assessment. And here, again, we are using ambient monitoring to look at changes in gait and balance in older adults that might be predictive of falling risk, increased fall risk. Combined with medication intake and demographic information, age, and so on, we know this person is on this medications, their gait used to be good a month ago, and now their balance has changed to the point that they're at a high risk. So we can send an alert to their caregiver and say, this person might need your attention. Maybe they need a physical checkup. Maybe it's a new medication they're taking that is affecting the balance. Maybe it's an underlying health condition, or maybe it's just a natural process of aging and they need a walker. Whatever it is, it would be wonderful to prevent a fall if we can, without having somebody watch them and continually assess them as a person. If we can do some of this with an AI tool, that would make the provision of care much more efficient and effective, and hopefully prevent some falls.
Yeah, I think that's a great example that is more targeted, and you can see the potential knock-on effect. I think many of us know of someone who know someone who knows someone. An elderly person has had a fall, results in a broken hip, and then it's just a steep decline in the quality of life, unfortunately, of that individual, as well as a huge ramp up in the cost of care for individual. And if we can prevent that, in a smart way, and Babak, what you're talking about, sort of combining that gait analysis and also thinking about medication as well as other factors, other risk factors, would allow a more real-time impact. So you could see the sort of downstream impact of that if it could be rolled out in a widespread way. Let me go to Mark, you for just give our audience a kind of a case or an example of one of the sort of advances that we're talking about in general terms here that would have some specific applications.
Sure. Well, I'm going to talk about the product that we have at Sennheiser called To Race With Me, and it's developed for seated exercise. And the idea is that older people need more exercise. We know that. And exercise is beneficial both to the brain and to the body. But people are not very good at getting exercise, especially when they get older. And there's lots of reason for it. And sometimes they just have balance. They have congestive heart failure. They're fearful of heart attacks or falls. So you sit them down and it's much safer. So we have a system where it's like a Netflix on a hamster wheel, where we have scenic videos from around the world, and they tour the world while they're pedaling, and they have to keep pedaling to see the videos. And we found that this is very sticky, that people like it, and it's in settings, 21 settings in across Canada now, with adult day programs, assisted living, retirement homes, long-term care homes, and a rehab hospital. And we're about to introduce our first Trace Me unit in Tokyo. So we're kind of excited about it. And what's good about this is that people can get exercise relatively easily, and they're motivated to get exercise. So it's almost like playing a game. Now, when we started this, there were other people who were doing this kind of thing, but they thought you had to have reminiscence. So you had to see the street where you grew up. So they had people out filming the streets of all these people. I looked at this is not scalable. So, I bet that people also want to see new stuff. Why not? Why should people wallow in the past? So we deliberately had a plan where we just gave people GoPros and had them go around the world every time they were traveling and shoot video for us. And it's worked for us really well. We have over 350 videos now from around Canada and the world. And meanwhile, the companies that were doing the other stuff just went out of business because, of course, it was unsustainable.
Right, spoken like a true professor and entrepreneur. So that's a great answer and a vivid example. So maybe this is at the end of the phrase couch potato for all of us. We'll all be pedaling to be able to watch Netflix or Amazon Prime or the hockey game or whatever it is. Maybe if folks could pedal to make the Leafs win the Stanley Cup, then Torontonians at least would be pedaling.
Or to power the lights in their house.
Power the lights in their house. Yeah. So incentives work. Jen, over to you.
Yeah, I mean, those are all great examples, and I'll highlight a couple in the field of social isolation and sort of human connection. So one of the biggest determinants of longevity, we know, is your ability to maintain strong relationships with people around you as you age. And so often, in our current society, people don't have opportunities to engage, to speak. And as you would start to withdraw from human interaction, it also kind of multiplies on itself. You become less confident. You don't want to reach out to other people. So I've seen some really interesting innovations come up. I mean, there's a lot going on in the robotics space in terms of putting devices in people's homes that can react to an older person's intent, can help engage them and stimulate them cognitively on an ongoing basis. It's partly why we designed our platform to be delivered over the phone as well. Often we're the only people that they're talking to on a given day, and so it gives them a chance to practice that conversation. And then it can be as simple also as making communication devices more adaptive to an older population. My father just bought my 98-year-old grandmother a device that makes her smartphone very simple to use. You simply press a button or it answers itself. And just by doing something, making a technology actually simpler, you can enhance the ability of an older person to continue to engage with technology, but in a different way. And so I think there's so many practical examples in daily life. We see the challenges, and we have the opportunity to really redesign technology and bring things into the home in a way that we haven't done before. And I would just mention, I was down at the Big Health Conference in Las Vegas this week, huge Canadian pavilion down there, so many Canadian innovators, and this is an international conference full of investors from all over the world. I would just say, we're on the national stage in Canada in terms of being a leader in this field, and even within the age tech space, there's so much interest and activity from both the startup side and from investors.
That's really interesting, and it's good to hear that Canada is doing so well in this arena, and obviously a super important one. We touched a couple of times on the importance of prevention. You know, Mark, when you were opening, you really sort of talked about this as a long journey. I'll call it a kind of an ultra marathon and not a sprint in terms of aging. And perhaps our model has focused too many resources, you know, sort of at the end of that journey. And let's sort of let's back that up. But we also have, you know, individual responsibility, opportunities to, you know, to influence our path on that journey if we, you know, if we start early enough. So I want to talk about prevention and any things, tips or tricks or recommendations that you would have for audience members. All of us are somewhere on this journey, and it's probably never too late to start. But if we have some runway, what should we be doing now when we're perhaps not really thinking about ourselves as an elderly person? What could we be doing now that would help us on that journey? Let me go to Mark, and then I'll come to Babak.
So we did a project with Public Health Agency of Canada a while ago where we were with a company called Cyber Seniors, and we were looking at dementia prevention strategies based on the research literature, and we came up with like about 12 of them, and we made some like 10-minute videos that summarized, you know, things like hearing loss, surprisingly, is one of the biggest risk factors for dementia, and so is poor sleep, so is depression, you know, so obviously is blood sugar management and blood pressure. So we know what the risk factors are. The problem is that people are very bad at making changes to their habits, right? And so I'm a real fan of behavioral economics and the idea of nudge that Richard Thaler put out. And, you know, the idea is that if you just get people to push them in the right direction, they will, in fact, do the right thing. So, you know, one idea is, you know, you put better food in their fridge, you show them sort of the right kind of advertisements. There's all kinds of things you can do. You know, you take the sugary drinks off the supermarket shelf. This is what the mayor of New York tried to do a few years ago, but unfortunately the sugary drinks manufacturers wanted those 2-liter bottles back on the shelves, and they got it. So, you know, there's such a lot of pushback and such a lot of, you know, bad advertising and bad corporate behavior, which is making it so difficult for people to do the right thing. And there's all kinds of, you know, behavioral tricks that you can play, you know, that make people sort of with their dopamine systems, you know, look for reward in the wrong places. So, you know, I think that nudging and also better regulation to stop people doing bad things, you know, financial management is a big problem for the elderly, and they should not be gambling. Online gambling is, I don't know why it's even possible in Ontario. Thanks.
Yeah, there are a lot of policy questions that you touch on, and there is actually a behavioral economics unit at the Rotman School that is looking into this nudge concept. It's one that's I think well researched, but was revolutionary when it was first introduced. The idea that we are not necessarily entirely rational in our choices. And sometimes we need incentives to help us get there, including peddling for our favorite shows on TV. Babak, let me come to you on this.
Yeah, exactly what Mark was saying. We know what the modifiable risk factors are: inactivity, smoking, healthy diet, managing diabetes and things like that. Social isolation also. The challenge is how to address those. How we know what needs to be done. How do we do it? And maybe again, there's a role for AI and technology to play in this nudging mechanism. Can be see if somebody's. And I was at a different conference last week. There was a group that had developed a model to predict if somebody was going to lapse in their effort to quit smoking, and predict based on their behavior and some responses to some quite simple questions on their phone whether they were going to restart smoking, and hopefully do some intervention or something to prevent that. So there is a role for technology and AI to play with that. I'm not sure exactly what that is, but hopefully we'll get there.
Yeah, we need something that sets up incentive.
Yeah, exactly.
Even simple works. I wear my Fitbit and I try to feed it every day because I want to get those little batches. But it keeps me going and a little bit more mobile and a little bit more limber. Jen, why don't I ask you to weigh in on this question also around prevention, and how we can start early.
Yeah, I mean, prevention in the brain health space is everything. I think we're just starting to learn, for example, that a lot of the changes that show up later in life, these start much earlier in life. And Mark, to your point, they estimate 45% of dementia cases now are preventable. These are lifestyle modifiable factors, changes we can make early in life that can impact our risk of dementia later in life. But one thing, to build on these comments that I wanted to highlight, and I highly recommend Louise Aronson's book, Elderhood, to everybody watching, is the mindset that we bring into aging as a prevention tool. So her thesis is, if you come into aging with a positive mindset, in the sense that it's not all about loss and decline, it could be the best years of your life, you are going to make better decisions about all of the things the panelists have been talking about today, which is related to your lifestyle, to your behaviors. If you come in with that kind of positive attitude, you're much more likely to take action and to be proactive about all of these factors. So if there's one challenge to you all, it's, make your elder years the best years of your life, and don't simply look at it as a time of loss.
I think that is really, really valuable advice. And I was struck by something else you said, Jen, when you spoke about how much of dementia is actually preventable. I mean, I think we think about healthy habits like, I feed your Fitbit, and in terms of, physical well-being. But it sounds like there is a lot of things that we can be doing and avoiding doing to enhance our cognitive health. And I think we're understanding more and more and more how those things are actually tied together. And again, it becomes sort of, a sort of a whole ecosystem, if I can call it that, of healthy behaviors and mind, body, spirit. Okay, we're coming close to the top of the hour. I am going to ask you for a key takeaway shortly, but I'm going to come to at least one more question. And I want to talk about the frontiers of research. So, there's a lot of work that is being done at U of T, and a lot of money that is being raised through Defy Gravity. And of course, we want to continue on those goals. If you were able to direct, say, a large philanthropic gift or government investment into a research area that was focused in this space of empowered aging, what would be your top one, maximum two picks? And I'll go to everybody on the panel. I'm going to start with you, Babak. I'm going to put you on the spot.
Yeah.
Where would you resources?
Prevention, continuous monitoring of symptoms to prevent catastrophic events. So that could be continuous monitoring for symptoms of Parkinson's, for symptoms of dementia, falling risk, pain, all of those. We have ongoing projects for all of those. I would love to expand any of those and build up on our capacity to develop AI-based continual assessment and prevention models.
Great. Mark.
Yeah, so I'm really enamored of the naturally occurring retirement communities. These are tall buildings with lots of older people in them. Toronto has probably around 500, if not more. They just haven't been counted yet. And they're great places, laboratories, and places where we can make changes to people's habits and support them in healthier aging. And I'll give you an example. City Park Co-op has over 300 people over the age of 65. It's Canada's largest co-op. It's heavily LGBT, and it's lowest socioeconomic, so you can make a big difference. And every month, the Healthy Aging Committee brings in a team of paramedics who are available to help people with health problems and to give them advice and to measure their blood pressure, anything else they want to do. So I think that's such a great model, and I think that you could really make a huge difference to a lot of people if you targeted these tall buildings with so many older people in them. Thanks.
In terms of you're talking about kind of creating community among elderly people and then providing targeted services to them. And you said there's 500 in Toronto?
In Toronto, that have been counted so far, yes.
Oh, wow, that's something.
If you do the numbers, that each one has maybe a few hundred people in these tall buildings, and if 30% or more of those are seniors, then you're looking at, I don't know, tens of thousands at least.
Yeah.
Somebody smarter than me can do the math, but I think you're looking at quite a few 100,000.
Right. And there may be some opportunities to that mixed communities, but where there is a significant population of elderly people. Jen, let me come to you. If you had the opportunity to direct research dollars, philanthropic, government, otherwise, where would you focus that investment?
Yeah, I mean, my answer might be kind of predictable, but I would pick brain health. I think, you know, we've invested so much into sort of our infrastructure and services for physical health, but we've largely neglected the importance of cognition and healthy brain aging over the entire life spectrum. And there's so much to do in the space. It's also just a time where there's a lot of innovation going on. We have new drugs coming on the market for Alzheimer's disease. All of this depends on earlier detection, being able to understand changes that are happening earlier in life, and ultimately it's an issue that people really care about. Dementia is the most feared disease of older adults, and it's something that really impacts one's own identity as we age. And there are things you can do. I think this is the message that really just hasn't gone out to the mass population. There's some amazing trials that have shown lifestyle modifications can prevent and delay cognitive impairment later in life, and we just have to implement some of these best practices as well as innovate on new solutions based on the knowledge that we're building. And this is coming out of universities like the University of Toronto, and it's also coming from studying populations at scale in other jurisdictions. The Finnish government has done a lot in this respect, and there's a lot we can learn from other jurisdictions.
There was a lot in that answer, and what I was thinking of was, when I'm procrastinating by wordling, I am going to tell myself that I'm actually investing in my brain health by doing a puzzle. At least that's the message that I'm going to give myself. Okay, we are just about at the top of the hour. We've had a super rich conversation, so I'm going to give you probably the hardest question, which is to just give me one key takeaway that you want to leave our audience with here today, before we bring this home. I'm going to go to you, Mark, then I'll go to Jen, and I'll finish with Babak. Oh, you're on mute there, Mark.
Yeah. So I guess my suggestion would be use enjoyment, capitalize on enjoyment, make things into games, nudge. And it's not a very good single takeaway, perhaps, but I think we can do an awful lot by just letting people enjoy their lives more.
Yeah, great advice. Learn the clarinet. Might be one specific thing you could do. Jen.
Yeah, I guess my message will go out to all the potential entrepreneurs. I'm a mentor in the hatchery in the Faculty of Engineering, and there's just so many great ideas out there. Come join the movement to change aging. We need all the smart people we can get.
Fabulous call to action. Babak.
Jen and Mark, and I think you also mentioned that touched about happiness and aging, and there's actually research confirming that happiness dips around middle age. So it tends to be around the lowest level around 50 to 55, and it's significantly higher when people are around 70 and older, until their health significantly declines. So aging is not a problem, it's an opportunity, and hopefully we can use AI and other technologies to support older adults and their caregivers.
Wow, what a great, uplifting, optimistic way to end what has been a fantastic discussion. On behalf of all the audience members, I want to thank our panelists, Jen, Mark, and Babak, for a super rich conversation. And thank you to our audience for first registering, and then also providing us with such great questions, such rich fodder for the conversation that we've had today. Do look for a survey that is going to be coming to you in your email about this event, and we are including those links to other upcoming events and engagement opportunities with U of T resources around this question of aging in place that I think you'll find really interesting. So I encourage you to respond to that survey. It helps us shape our programming, and there are some interesting links and further connections to information for you in that. So as we do close, I want to point out how well the University of Toronto is aging in place as it approaches its 200th birthday. Yes, U of T is older than our confederation. And as it continues to succeed at excellence and accessibility at scale, which I think is its vision of empowered aging, it can only continue to do so with widespread support from people like you. Join the growing community of alumni and friends supporting U of T through volunteerism and donations, communities that I'm a member of, and I promise you from personal experience, it's a great investment in your own mind, body, and spirit, and so for your own healthy aging journey. And with that, I say thank you. Until our next dilemmas and disruptors, be well.